Let's get started. Are you having problems digesting food? Are you experiencing heartburn, gastritis, or digestion issues? Have you been suffering from a feeling of discomfort after eating for the past few months? If so, don't worry. We've got your back. In this video, I'll be sharing with you the golden tip that can greatly improve your digestion. This is a very important information that can benefit everyone who is struggling with issues like these. So please do me a favor and click the like button on my TV channel while we're talking. It would be great if you could also share this video on WhatsApp, Facebook, or Instagram as well. Thanks in advance. Get ready for a new way of looking at your stomach. In this video, I'm going to teach you how to look at your stomach differently. Instead of focusing on the foods that cause heartburn or gastritis, or the medications that can help with reflux, I want to show you how looking at your stomach in a different way can change your life. It's all about understanding what's happening inside the body, and then making small changes that will make a big difference. Let's get started. I know that you're watching this video because you're sick of feeling nauseous and having morning sickness. I'm sorry if you wake up feeling nauseous, especially when it seems like everything you eat makes you feel bad. I'm sorry if your stomach feels like it's trying to push itself out of your throat. I've been there. It's no fun. But the good news is that it's not your fault. This is something that happens to millions of people around the world, and it can happen to anyone, even people who have never had a pregnancy. Many of us are misdiagnosed, and we end up getting treatment for the wrong thing. There are even stories of people who have been treating their gastritis and reflux with medications such as omeprazole, Prilosec, pantoprazole, Nexium, or esomeprazole, and yet they've seen no improvement at all. Pay attention, everyone. I know it's been a while since I've had to write this message, but we all need to pay attention. We all need to understand that if you're experiencing any symptoms and not having a high digestive endoscopy, then it's still important. It's an informative and worthwhile procedure. However, if you've been experiencing persistent symptoms for more than 6 months, then a high digestive endoscopy is essential. There's no question about it. If you're still struggling with difficulty swallowing, then a gastroscopy is urgently needed to determine if there's any irritation. It could be a tumor in the esophagus or the card area, where the esophagus and stomach meet. Therefore, if you're experiencing pain and difficulty swallowing, it's imperative to have a technician perform a swallow test, particularly if you're a smoker and it's causing irritation. Lactose intolerance is a common condition that affects many people. Those who have it can experience symptoms when they eat foods that contain lactose, which is the sugar found in milk and other dairy products. However, if you're experiencing symptoms for over 3 months, it's worth getting an endoscopy done to rule out conditions like Crohn's disease and irritable bowel syndrome. However, I want to draw your attention to 4 specific details that I've investigated in my patients to ensure they're not treating the wrong condition. The first thing to investigate is whether the individual has lactose intolerance. It's important to note that lactose is the sugar found in milk, which can also be present in cheese, cakes, sweets, pudding, condensed milk, yogurt, cream, and breast milk. As we age, the enzyme lactase becomes less efficient and can cause lactose intolerance in many people. Today, one of our patients came to see me because he had been suffering from intestinal polyps and gastritis. I diagnosed him with lactose intolerance and advised him to avoid milk and dairy products. He switched to lactose-free milk and vegetable milk such as almond milk, coconut milk, and soy milk. He reported improvement in his symptoms and had not experienced gastritis or indigestion since then. He had been wrongly diagnosed with gastroesophageal reflux for over 20 years. Therefore, I suggest that you ask your doctor for a lactose tolerance test or a genetic test for lactose intolerance in the blood. If you've been suffering from stomach problems for a while and your doctor can't figure out what's causing them, it might be worth getting screened for celiac disease. Celiac disease is an autoimmune disorder that affects only people with the genetic predisposition to develop it. It occurs when gluten, a protein found in wheat, barley, rye, and oats, is ingested and triggers an immune response in the small intestine. It's estimated that 1/3 of the population has some degree of intolerance to gluten, but only 1% actually have celiac disease. Unfortunately, testing for celiac disease is usually done by endoscopy, which involves inserting a small camera down your throat into your esophagus and duodenum. This procedure isn't painful but can be uncomfortable if you suffer from heartburn or reflux. If you are diagnosed with celiac disease and have persistent symptoms that don't improve after following a strict gluten-free diet, meaning no more than 20 grams per day, then you may need surgery to remove part of your small intestine or intestine entirely so that it doesn't process gluten anymore. Today, a patient came to me with pain and nausea in the stomach area. However, the pain was in the middle, and I asked for his weight and medical history. Upon examination, it was found that he had gallstones. I explained to him that thickened walls of the gallbladder are known as cholecystitis, and his condition was indeed caused by gallstones. The patient will need to undergo surgery to remove the stones. He also mentioned that he had consulted another doctor from a different city and state outside of California who had recommended him for surgery. However, after talking with him about his condition, I realized that he did not need surgery immediately because there were no symptoms of any other diseases or problems other than having stones in his gallbladder. This is because having just one stone requires only a simple procedure called gallbladder removal. It may take up to 2 weeks before your symptoms are gone completely after removing the stones from your gallbladder. What's the difference between a gallbladder attack and liver inflammation? It all comes down to where you are feeling pain. If you're experiencing discomfort in your right upper abdomen, most likely you have an inflamed gallbladder. If you feel pain on the left side of your abdomen, however, it's possible that you have a fatty liver. If you have any symptoms of hepatic steatosis, fatty liver, you should see your doctor for an ultrasound to rule out this condition before assuming it's just gallbladder pain. In addition to requesting an upper abdominal ultrasound to check the liver and gallbladder, we also request laboratory tests to check for liver enzymes such as GGT, AST, ALT, and bilirubin, as well as amylase and lipase for pancreatitis. To ensure a comprehensive diagnosis, we recommend investigating lactose intolerance, gluten intolerance, gallstones, and fatty liver. Please feel free to share this video with your friends on social media platforms and subscribe to our channel for updates on our latest publications. Join our Telegram group and follow us on Twitter or Facebook where I usually respond to comments and questions. Thank you for watching.